Hello everyone, I'm Faraz ahmed, and today I'm going to talk on a disease called as Wilson disease. It is also called a hepatolenticular degeneration. A hepato means a liver and lenticular means a CNS. So it affects two major organs in a liver and CNS. Well, Wilson is a genetic disorder. It is a autosomal recessive disorder in which the metabolism of the copper is impaired so that the copper accumulates in your body, and this is because there's a mutation in gene called a VD gene which is located on chromosome number 13. Now to understand it, we must know that how the copper normally absorbed in a body. The copper firstly absorbed from your proximal small intestine, then it is transported in a liver, and then it incorporated with a protein called as ceruloplasmin, and then finally it excreted in a bile. But in Wilson disease, what happened that it normally reabsorbed from a proximal small intestine, then comes into a liver. That is normal. But what happened? This is intact. But what happened that this cytoplasmin is not synthesized in this disease. So this copper does not incorporate in this binding protein and does not excrete it in your bile, and then it accumulates in a different organs of your body. So let's talk about where does it deposit. Normally it happens at about 10 to 25 years of an age. That is a normal age where it patient present with. In children, remember the first disease that appear is a liver disease. A first sign in a young adult is actually a CNS disease. So in liver, when the copper accumulate in liver, it causes hepatitis, it causes cirrhosis, it causes hepatomegaly. But in CNS, when it is going to deposit in putamen, it tend to cause a tremor. It tend to cause tremor. And when it is a deposit in a subthalamic area, it causes hemiplasmus. Once it is accumulate in cerebral cortex, it causes dementia. And once it accumulates in basal ganglion, it causes Parkinsonism. Other CNS feature could be dystonia, astraxis, chorea, and dementia. Remember, it does also cause some depressions, some manias, and sometimes personality changes as well. And it also affects your eye, where it tend to cause a K-Fisher rings. These are actually a green-brown discolorization on the cornea. They are deposited at the Descemet membrane, and it can be a single clinical diagnosis to you, but it vanishes once you give the treatment. It also affects your kidney, where it tend to cause a renal tubular acidosis in Fanconi syndrome. In the blood, it causes a hemolysis, and it also causes a blue nails. Now, how do we diagnose this? The first most important test is the ceruloplasmin level, that is decreased. It is a single best clue to your diagnosis. Other is a increased serum copper excretion, that is more than 1.6. Remember, a copper level is not the test that you want to do, because the copper can be normal, the copper can be low, copper can be high. So it has never been the test that you wanna do. The liver biopsy, however, can be a sensitive test to diagnose it. It can tell you a increased hepatic parenchymal copper concentration. But I feel that the most accurate test is your penicillamine challenge test. Remember, a penicillamine challenge test is actually a chelating agent which is given to the patient, and then we look for the copper level. If the copper is excreted more in the urine, it tells you that there is a problem in copper binding protein. So the penicillamine challenge test is the most accurate test. You can do an MRI to look for that deposition in basal ganglion. So how we manage? You should avoid a copper diet. You should be taking a low copper diet. You should be avoiding the organs like shellfish, nuts, and chocolates. And we have the medical treatment in penicillamine, which is actually a chelating agent, which chelates the copper which is present there. But be aware of the bone marrow suppression with penicillamine. We have trianturin, which we can use, that is used for the CNS manifestations. For the maintenance, we have a zinc salt, which is actually other low dose chelating agents. We can also give a zinc in patient with a asymptomatic Wilson disease, and in the last we can use a liver transplantation as well. Now, this is the Kingfisher ring. Look at this picture. These are the green brown discolorization over the cornea under the Descemet membrane. So these are the pathognomic for the Wilson disease. Now, in this picture, you can see that once it go into CNS, it tend to cause Parkinsonism. In eye, it can cause a Kingfisher ring, and liver, it tend to cause a liver cirrhosis. Thank you guys for watching. Please subscribe my channel for more videos.